forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello and good morning to everyone who's watching us today. We're here once again with the other program of Imam Reza Educational Programs of Tabriz University of Medical Sciences. Today I'm honored to have my guest, Dr. Mahmoodpoor, who's a professor of intensive care medicine in Imam Reza Hospital. Hello dear Dr. Mahmoodpoor, I'm very happy that I'm hosting you today. I know that you're here with two great programs, and one of them is about mechanical ventilation in critically ill patients, and the other one about the nutritional assessment and also medical nutrition therapy of these patients. First of all, let our audience know you. Please briefly introduce yourself, and we will go to talk about your programs later.
Hello everyone and good morning. I'm Mahmoodpoor, Professor of Anesthesiology and Fellowship of Critical Care Medicine. I have almost 20 years of experience in the field of critical care medicine and manager and director of Fellowship Critical Care Medicine program in Tabriz University of Medical Sciences. And I am the head of General ICU of Shohada Hospital.
Thank you very much, it's great. Let's start with mechanical ventilation in critically ill patients. Please give us an overview and of the importance of this program.
As you know, mechanical ventilation is one of the most common interventions implemented in critically ill patients. Most of critically ill patients need mechanical ventilation during their ICU stay. The goals of mechanical ventilation are improving gas exchange, increasing oxygenation and decreasing carbon dioxide, and decreasing the work of breathing. So each physician should know the indications, monitoring, and assessment of good practice for mechanical ventilation during the stay of patients. So in this course, we will try to perform and educate these scenarios for our participants.
Okay, thank you very much. And can we now talk about the objectives of this course? I mean, what you expect from the participants after completion of this course they will gain?
We will focus on mechanical ventilation history, physiology of respiration, respiratory monitoring, type of ventilation, for example, invasive versus non-invasive. Organ-organ interaction in patients with mechanical ventilation. Different types of ventilators and different types of modes. For example, basic modes versus advanced ones. Weaning and liberation from mechanical ventilation. Complications of mechanical ventilation, which are so important. For example, biotrauma, barotrauma, volotrauma, ventilator-induced lung injury. Setting of mechanical ventilation in different diseases and comorbidities like asthma, COPD, ARDS, and etc. And respiratory adjunct therapies like physiotherapy, aerosol therapy, suctioning, and finally personalized mechanical ventilation therapy.
Thank you very much for explaining all the issues that you are going to cover in this course. And I have a question about the duration of this course. How much will it last, and will it be an online course, or the participants should come and practice in the field?
The duration will be almost 1 month, 30 days, which has two separated parts. The first 10 days consist of theoretical sessions, and the second 20 days consist of insight in the field of critical care medicine, beside the patients, education, assessment, management, and policy making of different scenarios in ICU setting.
Okay, thank you very much. And who are eligible to participate in your classes or in this course?
All physicians who work in the field of critical care medicine, like anesthesiologists, internal medicine, or surgeons, and etc., and also respiratory therapists could participate in this course.
Thank you very much. Is there any other thing if you want to tell us more about this course?
Nothing, and thank you very much.
Thank you very much. Now let's go through the second course of yours, which, as I said at the beginning, it's about medical nutrition therapy in critically ill patients. And as you know, this is also my field of interest as a nutritionist. But I'll ask you to talk about the importance of this course.
As everyone knows, malnutrition is one of the most common complications in patients admitted to ICUs, and appropriate assessment and management of this complication, which now we call it medical nutrition therapy, is so important. So each physician and each, for example, nutritionist who in this field should be familiar with appropriate assessment, monitoring, and management of malnutrition in these patients, as this complication could increase the mortality of patient, and appropriate management of this can decrease the length of ICU stay, the length of hospital stay, which can result to decrease mortality.
That's totally right. You mean that it has great effect on the outcomes of the patients. And let's talk about the objectives of this course briefly, but more in detail, that what the participants will gain upon completing this course.
In this topic, we focus on who are eligible for medical nutrition therapy by assessment tools and different scores. When to initiate MNT, for example, early versus late. And the most important point is how early is early, and how as the route of administration, enteral versus parenteral versus combined route, and how much energy and calorie should we order to our patients. The balance between energy and protein, which are so important. What formula should be considered for our patients, and supplementation with different specific nutrients. For example, immunonutrition, like glutamine, arginine, different biotics, probiotics, prebiotics, symbiotic, postbiotics, and omega-3 fatty acid. Monitoring and complications. As you know, medical nutrition therapy has many complications, and we should know these and familiar with the complications. And finally, tailoring MNT to personalized nutrition therapy in the field of nutrition therapy in critical care medicine.
Thank you very much. I want to ask who are eligible to participate, but I can guess that anyone who is working in the nutrition and diet of the patients admitted in critical care unit can participate in this course. Any physician, any nurse, or any nutritionist working in the ICU. Am I right? Or
yes. Absolutely. Any physician, any healthcare worker who are involved in the field of nutrition in critical care, in critically ill patients, are eligible for participation in this course.
Thank you very much. And at the end, I want to ask about the duration of this course.
And the duration of this course will be almost 30 days. The first part consists of 7 days of theoretical sessions, and the second part almost 3 weeks of in-field assessment, evaluation, and management of nutrition therapy in critically ill patients.
Thank you very much. And is any other thing if you want to add to this explanations? I mean, both of the courses. Is there anything you want to say about this
No,
one?
thank you, and thanks for you and your great team.
Thank you very much. Thanks, everyone. If you have any further question about our programs, you can follow the link that you see in subtitle, or you can contact our team via the email address that you see. Thank you very much.